Hi everyone, welcome to Tea Time with Rising Scholars. Rising Scholars has been a global community of scholars from all over the world, and Tea Time with Rising Scholars, previously known as Tea Time with Authorate, is a platform where all of us come together to connect, to network, to have a discussion on certain topic, to share our opinions, our challenges, and how we are navigating those alongside exploring the collaboration opportunities. Um, I'm so glad all of you are here today, although it is Friday and many of us are already in the weekend mode. Thank you so much for joining in. I have already started the recording of meeting, and a message must have popped up on your screen when I started the recording. So your being here is equivalent to the consent to recording this meeting. My name is Asta Subedi. I work as community administrator at Rising Scholars, and I'd like to welcome all of you on behalf of Rising Scholar. Today we have Joy. Joy is already there. Say hi, Joy.
Hi.
Yes. Yeah, Joy is here with us today. She is going to be our host. And as you all know, the discussion theme of today's event is climate change and health. I hope all of you have tea or your favorite drink on your hand. I have a bottle of water which I'm gonna drink while I'm at event because I don't feel like consuming any sugar today. And I really hope you also are with your favorite drink. Uh, and we will be talking about how climate change directly, indirectly affects the public health, the role of research in shaping the climate resilient health system, community level strategies for adaptation and mitigation, and how to communicate these issues effectively with Joy. Uh, I would like to introduce you to Joy. Dr. Joy is a UNFCCC certified climate and health advocate and an African climate and health responder. A member of the Pharmaceutical Society of Uganda, she is actively involved in national initiatives such as Uganda's Health National Adaptation Plan, as NAP, promoting a climate smart health workforce. She has facilitated climate and health workshops for over 500 people and led environmental restoration initiatives by planting over 500 trees across Uganda. A strong feminist voice, she mentors young women through the Girls for Girls G4Z platform and organizes outreach programs supporting orphanages and prison communities. Her work is a blend of science, advocacy, and compassion. So before I hand it over to our host of the event, Joy, I'd like to set some ground rule for the event. Please unmute yourself when you are not talking, but this is a networking and discussion event. So feel free to talk and share as much as you want to. The second is use all the interactive tools that we have in the Zoom. So there is the closed caption available for your own comfort. It is in the More tab there. If you don't find it, feel free to message me at any time. Also use the chat box. And if you are comfortable, turn on your video and let's make it very interactive. I look forward to learning and sharing with you all. Over to you, Joy.
Good afternoon, good morning, good afternoon, good evening, researchers from around the world, wherever you are. I'm happy that you've been able to join us today for this important discussion. I'm happy with the numbers we are seeing on the chat. Thank you very much for taking time off to discuss this topic today during your tea time, the vital topic of climate and health. It has been gaining some traction in recent years, majorly since COP29. So I'm happy that you've taken time off from your busy schedules to listen to us today. Maybe what I should say, though, is this is a discussion, really. I'm not going to lecture. I'm not going to present like a couple of slides and like listen to questions and answers. I'm looking forward to feedback from you. I'm looking forward to your thoughts and ideas on this topic. We are going to talk as researchers and academics today about this climate change and health. So really, the background of climate change and health is it comes from it at first the during the COPs those COP conferences. Really, it was majorly fossil fuel reduction, adaptation, loss and damage. But who was pushing for climate change to be really seen as a health hazard? So starting from the COP29, no, COP28, the one in Dubai, really, that's when climate change and health really picked up in the climate change debate. It stopped being a side event. The years before, it was a side event. But starting from COP29, really, it became like a major topic. There's a full day, yeah, in COPs to discuss climate change and health. Why is it relevant to see climate change and health together? Why is it important for them to be linked? Why is it important for us to have this discussion? One of the reasons, though, is yes, climate change we've seen, according to recent research, it's starting to also affect human life, starting to affect the human person. Additionally, we also hope in the climate change debate and discourse that perhaps if we see climate change as a health hazard, maybe we shall urge policymakers to act faster, mm? Act faster to mitigate it, act faster and respond faster to the issues around climate change. As you know, climate change usually policymakers are slow. The really countries have to be dragged even to contribute like to efforts to mitigate it. So we are hoping that if we expose the negative health impacts of climate change, maybe we shall urge policymakers to respond faster to the climate change crisis. So that's the brief background of climate change and health. That's why it has picked up a lot of traction in recent years because UN and WHO together decided starting from COP29 back in this is 2024, back in 2023 to really make it a major point, to really make it also a pillar in the climate change crisis. Without further ado, let's see some of the items I prepared. So what is climate change? Yes, that's the definition according to the UN, long-term shifts and alterations in temperature and weather patterns, primarily caused by human activities such as burning fossil fuels, deforestation, and industrial processes. That's really the gist of climate change. Increasing temperature, increasing global average temperature with each coming year. Why is it increasing? Because they are letting a lot of greenhouse gases into the atmosphere. Greenhouse gases lead to an increase in overall temperature of the earth. Like it's like a greenhouse. A greenhouse is supposed to trap heat within it. So, but here it's happening on a global scale due to our human activities, as mentioned. So they trap heat, and yes, they lead to a rise in temperature. So this rise in temperature is offsetting a lot of other things, around the globe. As I've noted, from malnutrition, malaria, diarrhea, heat stress, all these things are being caused by this rising temperature. Sorry, help me project the next slide. Oh, yes, the next one. So those are the effects of climate change on human health. They can be divided into direct and indirect. Direct is what's the direct impact of this heat on human health. There are those direct effects which we observe. We as people can observe, like heat stroke due to increase in heat, water scarcity due to drought, water shortage, or sanitation. But there are indirect effects. Indirect effects, I mean, you have to link it back to climate change after some research. We are talking like agriculture is affected. If you say that climate change is affecting the food chain, how is it affecting the food chain? It starts with water scarcity leading to drought and then drying of crops within communities. So when these seasons are changing due to rising temperatures, we see that disruption of the farming cycle in local farmers, and their food chain is affected. In the long run, you see malnutrition and death among population. So those are the indirect effects. The other indirect effect is excessive rainfall. With climate change, we've noticed that the water balance is being what? Is being affected. Either you have excessive rainfall in communities or you have little or no rainfall. Usually, people were able to predict the rainfall patterns from years before, but due to climate change, you notice that some regions will be getting rainfall beyond perhaps what they've been getting. So we see floods, and with floods, the direct effect is drowning, of course. But of course, floods in an area can lead to waterborne diseases like diarrhea, like cholera. That becomes an indirect effect. All of a sudden, you see that uh, diseases which perhaps had been successfully eliminated from some populations resurface because of this changing weather patterns. We saw it, I think, some African countries are reporting cholera is coming back. Yeah, in communities, and when you do research, you look into floods reoccurring in some areas. Sorry. Next. Yes. We are seeing it in East Africa. The changing weather patterns affecting the malaria cycle. Communities that previously had little or no rainfall now get excessive rainfall, which means humidity. So you find a community which was perhaps immune to malaria. Their genetics were malaria resistant, but due to changing weather patterns, you see malaria starting to come up again. Eh? That something we call changing isotherms of disease, like malaria and dengue fever. All these are spread by mosquitoes. Mosquitoes love areas of high humidity and temperature. So if we see a rise in temperature, of course that means more humidity. Seeing more communities being exposed to malaria, communities that were not exposed before. It's mostly happening with malaria, with East African Rift Valley disease. So that's an indirect effect. All that's happening because of climate change. Talk about plus. Okay, now we are getting into air pollution. This can be both direct and indirect. Burning of fossil fuels, of course, you all know the outcome. That smoke, mostly in old cars or old motorcycles, and then there are our roads. When we inhale those dangerous gases, our they affect our respiratory systems. Um, it can be direct and indirect because this air pollution has been linked to chronic diseases in the long run. After some years, you see chronic diseases coming up in those populations. But sometimes the air pollution, air quality can affect directly. Depends on how vulnerable you are. Some people have weak respiratory systems, and others already have sick respiratory systems. For example, if someone has asthma, or they have COPD, or they have allergies, those ones are going to have direct effects. They're going to get episodes and they're going to be admitted in the hospital. Those ones are direct effects of air quality. But others, in the long run, if you are exposed to what we call ambient air pollution, slow, but over the years, you may get the chronic effects like cardiovascular disease, chronic bronchitis. So what I'm trying to say is that they are both direct and indirect effects. So if you are setting up a research for you are researching a topic of climate change and health, really it's you decide. Okay, you don't decide, but you have to put in mind what you are researching. Are you going to research perhaps the short term effects of climate change? Are you going to move to the long term? How are you going to set up your research model? How are you going to collect the data? How are you going to get access to this data? So you have to put this in mind when you are researching climate change and health. You have to put in mind that there are some direct effects and there are some indirect effects. Also, can you help me move to the vulnerable population slide? Those are some of the patterns. Yes. So when it comes to climate change and health, there are what we call the people who are more affected than others by this crisis, as you've noticed. So children, women, especially pregnant women, uh, poor people, smallholder farmers, children, uh, children, they tend to have weak respiratory systems. Their respiratory systems are developing. So if they're perhaps exposed to this poor air quality, they're going to be affected differently from us the adults. So when you are setting up your research, perhaps you can put in mind that maybe I'm going to research the effects of these vulnerable groups. This is what's going to be my control. Okay, you be innovative. Women, especially pregnant women, we've seen that they're affected by excessive heat. Uh, their their pregnancies are not stable when there are high instances of extreme heat. They may get miscarriages. Of course, the elderly, we know that they are not strong enough. They already have weak systems for these harsh environments. Poor people, poor people don't have the resources to deal with the negative effects of climate change. For example, if you are looking at heat, poor people may not afford ACs. They don't afford ACs. They don't afford sunscreen, and they depend on outdoor labor as their source of income. So on hot days when they can't farm, perhaps their families may go without food. So you put that in mind. For example, if you're researching climate change and food security, maybe what I've not put are the refugees. There's also something we call climate change mobility. It's a big thing. It's a big topic. Refugees, since they're away from their homelands, they may also not have access to resources. Also, climate change can lead to refugees. Like people may leave their communities due to landslides, due to floods, and they flee their home areas. I want to finish. Next. How we go to mitigation and response. So that's a response, how we can deal with climate change, how communities are dealing with climate change. Mitigation means reducing the flow of heat trapping greenhouse gases. Mitigation efforts, the major mitigation efforts that are happening planting of trees in communities. We've seen that trees can offset the negative effects of climate change. Research shows, very proved research shows that trees, for example, if they're planted in an area, they lower the temperature, they improve air quality, they also reduce instances of extreme, like excessive rainfall. And other ways of mitigation is what you call the transition to green energy, solar panels, all those efforts to stop the use of fossil fuels. Adaptation is a different thing altogether. Adaptation is it's already here. So what are we going to do about it? It has already happened. How are we going to adjust? Most of our climate and health efforts actually in adaptation. For example, if malaria has already come to this community, how are we going to help this community deal with it? Are we going to maybe introduce vaccines in the community? Are we going to maybe educate the community that previously you didn't have this, but now you have it? You look at you maybe as the medical supply, as a government, you know that now health centers you have to provide drugs for them for this disease. So adaptation measures really involve that it has already happened. How are we going to respond to it? How are we going to help the community deal with it now that it has happened? There's something we call environmental justice and equity. Uh, you have to put in mind, of course, when you're researching. It means environmental justice and equity is that there are people who are responsible for the crisis of climate change really need to pay up and pay more. They have to pay up and pay more and finance the mitigation and adaptation. So since this climate change crisis was caused by industrialization of the what we call the big economies like China or America. So we demand that, and it's now poor communities that are affected in the global south. So in the climate change discourse, we demand that in terms of justice really should be the people who've benefited more, who've been who are industrialized, not really pay for that, for these mitigation and adaptation efforts. And they're usually the ones that are going to, of course, fund the research, fund your interventions in case you decide to, let me say, research climate change and health. I think my time is up. Let me go to innovation. So innovations and climate change, really, they want us as researchers really look at innovative ways in which we can help communities and the human population at large deal with issues of climate change. So when we are writing proposals, or when you are looking for grants, really have to put in mind that what new thing perhaps are you introducing in this community? How are you going to, what innovative way are you going to look, what innovative way are you going to help the community deal with poor air quality? What innovative way are you going to help this community perhaps deal with extreme heat or vector transmission? Actually, the innovative ways are not so complex, can have original ideas. I know of an organization I know of an organization, for them, the innovative way was to, let me say, redistribute ACs within their community. They thought of a way that if there are poor people in our community and they're experiencing extreme heat and can't afford ACs, can't we get these people who are throwing away ACs, or the rich people perhaps who are moving out from the neighborhoods, or who are, let me say, moving up to bigger buildings, and can we perhaps redistribute them to the poor people? And that idea got funding. So it's innovative ideas don't have to be really extremely complex, but really it's as long as you prove to the policymakers that really this is how I've found that I can help this community deal with the issues around climate change. Uh, Climate change and health, really, the adaptation methods are focused on how are you going to help that community deal with the challenge of climate change now that perhaps you've seen that they're having this issue of climate change. So that can be your um that's the first question. Ask yourself before you start off like writing, let me say a grant, or writing asking, let me say, for a grant or asking for some funding when it comes to climate change and health. But when it comes to research, mm, research for climate change and health, you have to look at a broader perspective. We look at a broader perspective. You may need data from various resources, because when it comes to climate change and health, you look at the environment, you look at diseases, then you look at the community. You have to uh, you have to have a you have to have like methods of getting data from all those sectors. And most cases, they're in different, like there are different points. And for example, you may have to go to the Ministry of Health to pick up malaria data. You go to the Ministry of the Environment to pick up environmental data. Then you go to the community to pick up some data. Let me say that what they had recorded, whether at let me say between, let me say, January and June. Then you find correlations, and correlation. You have to find correlations in that data and prove that perhaps here, when there's high humidity, and then you have to compare from years prior, that here this community didn't have high incidences of rainfall, and there's less and there are less malaria cases. But we are seeing that within the previous 2 years, the weather has changed and the levels of malaria changed. So you have to link with many sectors when you are doing climate change and health research. That's all for today, really. Yes, Arthur. Or am I the moderator?
Yeah. Um, Thank you so much for the presentation. Now we'll move to the discussion session. I've seen that patients have asked a question. Please explain more on what innovative ways have been put in place in local Ugandan communities who are rural based and do deforestation for fuel and income.
The
Joy, do
in
you?
the Yes, yes. The innovative ways in local Ugandan communities. You've seen these people who encourage people to transition to briquettes. Do you people know briquettes? Those instead of using the traditional charcoal as a the traditional charcoal as fuel for food or like in homesteads, they're encouraging people to transition into briquettes. Briquettes are more longer lasting. They contain like they are more longer lasting, which means and they are produced from waste from around the homestead, the organic waste from around the homestead. When you collect it and use it to make briquettes, it means that lesser trees will be cut down within that community. That's one of the innovative ways. Maybe another innovative way is the government really has made efforts, has tried to legislate to stop the like cutting down trees. Of course, there's some resistance, but recently I think some leaders from the north were debating this. From the northern part of Uganda, they were debating that law that had been put into effect that to stop people from cutting trees. If you are found cutting a tree, there's a for charcoal, there's a penalty within the rural communities. There, I don't know about its enforcement. It was causing a bit of a buzz and discussion on social media. But yes, really, those are the ways I've thought of to help communities to stop cutting down trees. Maybe another one, apart from because is that there are discussions happening within the climate change community about how we can reduce the electricity fees, so that at least people use hydroelectric power, and then the hydroelectric power is a bit cleaner. At least it doesn't involve cutting down trees. So there are those discussions happening. I don't know if they'll come to fruit. Something will come out of them, but yes.
Why don't you submit your request now? Why do you have to wait till then? Why do you have to wait till then?
Patience, I hope I've answered you. Mary, I think you're trying to
Um,
say something.
I think Mary was talking to somebody else.
Mm.
Um, yeah, maybe anybody else would like to add what they have been doing at their own community level as innovative practices from around the world. We would like to learn from you all.
So someone was talking about climate change and mental health. Yes, that's also a very big topic, very interesting. It's also picking up steam, something you can research. Uh, what there I should note about climate change and mental health is that when you are researching, you have to be aware of the inclusion and exclusion criteria. You have to be sure that this mental health issue that showed up perhaps in this community or these patients, you have to rule out like previous admissions to hospital due to other things. Due to other things, for example, that person may already have that the mental health issue may be caused by genetics, purely genetics. Maybe, for example, if they are exposed to extreme heat and they had like a panic attack, they have to really be careful because when it comes to climate change and mental health research, it's you have to really rule out like some things that perhaps this person, let me say, got this mental health issue because of climate change. You have to rule out many things before you conclusively say that it is climate change and mental health.
Thank you, Joy, for sharing. I'm also thinking that there is also like climate anxiety in our generation. Like if we talk with our fellow colleagues, Gen Z people, there some of them are like really anxious about what is happening next, what could happen. For example, it is monsoon where I live right now in Nepal, and a lot of people are scared that there might be flooding, and it affects you mentally, the anxiety of what might happen. And I saw Dr. Jainab was raising the hand. Yes, Jainab.
Okay, I didn't want to prolong the discussion, but thank you very much for giving me the opportunity. I was just going to add to what the presenter has said as part of the solution to climate change. One of them on the short run is the use of biogas as fuel for cooking. It's been tried and tested in several places, and this is from usually from doesn't involve cutting down environments. It's usually from recycled waste. Different sources, all types have been tried and have been successful in many areas. Then let's not shy away from government efforts because um, those who come from high income areas, who come from the high income brackets, don't don't use as much wood from deforestation. So if the government is committed to this and they empower the citizens, the economy improves, then we're going to have less damage to the environment, and of course that should help to move the needle um, in improving climate change. Thank you.
Thank you, Dr. Zainab. Yes, that's a very good alternative. Biogas, we've seen it like transition to biogas as a community. And also your point of the high income residents helping out, the high income residents helping out in case like the low income residents can. There's something in climate change we call a community. Like as a community, you respond as a community, you come together because um, if you've read Laudato Si, the late Pope Francis document about climate change and environmental conservation, he really emphasized the community bit. If when we climate change is something which climate change is something which requires us coming together as a global community. You Yes, there are some personal choices you can make and should make as a person. For example, in your home, you can say that we are going to leave out fossil fuels, cooking using fossil fuels, and we are going to start using solar. We are going to transition, let me say, from the diesel car to diesel car to an electric vehicle or a motorbike. Yes, those efforts are appreciated, but really, it would be better if us as a community come together, as countries, as conferences, as like a global community. That's when really move the needle in a big way. So there's no escaping from this. Like we have to come together as communities.
Thank you so much, Joy, for adding to that. Thank you, Joyna, for sharing your insights. Anybody else has anything to add to the conversation that we are having around innovations and methods that we have used in the community right now?
I have a different question. I don't know if I can speak.
Yes, sure.
So my question is a bit unrelated, and apologies. I'm just joining the program. So my question is on data. So assuming one is really writing an academic piece on this subject, that's climate change and mental health. I'm aware that there's restriction in terms of data. Like, how are we able to understand that we can use qualitative means to assess some of these things through other means. But assuming someone wants to use like a mixed method, what recommendation do you have, especially from the quantitative side, to help out with data?
Joy?
The climate change and mental health data. If it's quantitative data, it depends also on what you are really researching. Right now, most researchers right now are researching the connection between climate change and mental health. We've not yet reached the intervention bit, like maybe this is what we are going to implement in our community. So the climate change and mental health data, that's why I told you that climate change and health data, it's a broad perspective. If you are to start, you of course start with data collection, but if you are to start
Hi, Joy. Um, are you guys sharing Joy?
No.
No.
I think there is a technical issue. Okay. I think she will be back in a while. Meanwhile,
I'm back.
anyone? Oh, okay, okay, Joy. Over to you.
Apologies. So where was I? They have to go to the hospitals and health facilities, and I get their mental health data. You collect like hospital admissions for those mental health. You get morbidity rates. You get like disease instances, but you have to set up a very careful exclusion criteria or even inclusion criteria. Really depends on your research questions. Such a data is not challenge that perhaps these people had other issues. Yeah, sometimes like these people may have other issues in their lives. Let me say work, because you know how mental health is. Let me say what triggered this episode of relapse. You have to exclude that all those other things that can start to like you link it to climate change. Uh, you have to now also go to the uh, sources for weather sources like meteorological data. You determine temperature patterns, determine rainfall patterns, you determine humidity patterns or extreme weather events patterns in that community. Now, it depends on which country you are in. For example, for us in Uganda, you may find it at the Ministry of Environment, or you may, if for example, a country like America, you may find it with NASA. It depends on how your government is set up. Then that's for quantitative data. You collect. You have to find the correlation, like correlation within all this data. You notice the patterns. Of course, here we are now using things like Python, SPSS, those things to find correlations within this data. You have to make sure that you align your data with time scale, month, year, location. You also look out for the missing data. So the interpret results is after you've done the usual after you've done the usual interpretation of data using your software. You have to analyze this data and interpret it. Also, of course, you have to find there is existing literature on climate change and mental health, and so it's there. It's present in journals. You, you may build up on that. But that's for quantitative. Qualitative, you have to use different themes. Of course, under this theme, under this theme, under this theme. You can set up both quantitative and qualitative. Qualitative, you ask people different questions. You ask the patients different questions. You ask the patient, but still you will need data from the weather. But when you notice, for example, a patient says, I was feeling hot, or I was feeling excessively cold. If you have your themes here, that temperature, those are things that shouldn't miss temperature. Let me say rainfall. Yes, when you are guided, okay, that's the rough bit of it. I don't know if I've helped you.
Does anybody in the room would like to add anything to the conversation about data and climate change and mental health? Or like, yes, Sarah.
Hi, sorry.
Hi.
Hi, Asta, and a very good afternoon to you all. Thank you so much to our speaker for today, Joy, for a very informative and interesting presentation. Um, I don't know if I don't know if what I want to say is a question. I think it's more of a comment. I just wanted to share my own research that I have been doing on the Somali community in Somalia. I have been looking into the role of traditional knowledge systems in disaster preparedness. So I've been doing research on climate change in a particular village in Somalia called Qardo. And I've been looking particularly at the flash flood disaster that occurred there in 2020. That was the first time that it ever happened, that, you know, a rainfall of that magnitude ever occurred there. And the community has found it very difficult to, you know, pick up and get on with life. I didn't really look into the aspect of health, but I just wanted to share in this forum that it's also very important to look into traditional knowledge systems or indigenous knowledge systems in combating or being prepared for disasters, floods, and droughts. My country, Somalia, has faced all of them simultaneously. In one year, we can have a drought, we can have a massive rainfall, and many other disasters have happened all at the same time. And there isn't much awareness about climate change. People don't attribute these changes in the environment, in biodiversity, to climate change. And I think there's a lack of awareness in general, and not only in Somalia, but I think many parts of Africa as well. Um, so I think one of the best ways that we can make our communities resilient is to you know, come back to our own ways of doing things, our own ways of resolving matters of things like, for example, land management, traditional farming methods, or even disaster preparedness, seasonal forecasting. All of this knowledge has sort of disappeared from the Somali society. Everybody's coming back from the village and coming to the towns. So there's a lot of people who are moving from the rural to the urban, and it seems like the community is not prepared for this, and a lot of knowledge is lost. For example, my research, I've discovered that in that particular community, they used to have ways of knowing when there's going to be a rain, there's going to be a locust invasion. There were signs and symptoms that people would look out for through sometimes the behavior of birds and camels. All of that is gone, and there's a lot of plastic litter also, which is contributing. So I think also in beyond the health aspect, I mean, health is very important. One of the things that my community was saying was that in terms of health, that people have become more, they're more anxiety and even heartburn, and they're not aware that this is actually as a result of their anxiety because of um, the sudden flash flood disaster that occurred has made people to become very anxious. I'm sorry I'm taking long to describe this, but I just wanted to bring in the component of disaster preparedness using our own traditional ways of, being resilient, being prepared, forecasting, predicting. All of that knowledge which we had in my communities disappeared and has made people even more vulnerable to disasters. Thank you so much.
Thank you so much for sharing that, Sarah. Uh, I would also like to add something. In the case of Nepal, it is a mountainous country, and um, the temperature in the mountain region is increasing every year, like it is increasing rapidly, right? And there was a news coverage on our national online medium where the people who are living just near the Mount Everest region, which is like the highest peak of the world, the people were complaining that it is getting very hotter and the temperature is at 9 to 10 degrees Celsius. And people in other part of the country where the temperature rises as much as 42 to 45 degrees Celsius in a year were laughing in the comment section, making fun of people who are saying that 10 degrees Celsius is hotter. Like it was like a meme for a few days ongoing. That's when I realized that people really don't have awareness about the issues. Like, I think the basic of starting how does climate change is affecting the lives and also the health or the livelihood is with the awareness. Like, uh, people are making fun of very pertinent issue, and that is not their fault. It is the fault of the entire system, which is blocking the resources and also the information. Yeah, over to you, Joy.
Thank you very much. Thank you very much. Your contributions, Sarah and Arthur. Uh, so what I can say, the first response I can say is that what we say in the climate change discourse is that climate change is an elephant. Where you touch is where you feel. So if people have raised many issues that different, like different tracks, different tracks in climate change. If I'm to get to Earth and like Nepal, mountains and increasing temperature, rising temperature is already going to cause issues in those communities. And then something we call melting ice caps of Mount Everest. Okay. So those melting ice caps are going to they are going to flow into communities. We've seen communities that they are melting ice caps. There's increased like water and humidity within those communities. Of course, now that's going to change a lot of things. It's going to change their agriculture. It's going to change their health patterns. Mm? And then there's the issue of anxiety, which also Sarah mentioned. Once you notice words like anxiety, panic, that's already we attribute that to mental health. It's like a mental health issue within those communities due to climate change. All those are different things, and you actually can't research or even deal with them at once. You as an individual, as an organization, one may be dealing with heat, another one will deal with health, another one will deal with agriculture and food. Okay, so like it's a wide thing. Like it's like how I said, an elephant. Where you touch is where perhaps what you can, maybe what you are more passionate about, or it depends on your abilities. So getting back to Sarah's point is that they had a flash flood. It had never happened before. So you can start from there. Why did it happen? Was it because of increased temperature within that Somali region, within the Horn of Africa? Then that's now an extreme weather event. Something extreme happened in that community. And what happened after? Of course, their food cycle was affected. Maybe this flood affected crop growth. Some crops don't just may not grow in what in regions of high floods. It affects their agriculture. It affects their nutrition patterns. Are we seeing higher instances of malaria? So if you are researching, those are some of the research things you can think about. Are you seeing high instances of malaria in this or dengue fever? And then she talked of she also had issues of anxiety and panic. That's mental health. You can research it in that community. And she also talked about a very important subject within climate change, indigenous knowledge. Indigenous knowledge which was available to communities from our ancestors, from our people from a long time ago that has been like eroded and lost with time. This knowledge used to help communities deal with climate, with these issues, but now it's no longer available, and you have now to go through a very long process for it to be like made available and even recorded perhaps somewhere. We are also seeing that in our communities this side in sub-Saharan Africa. You know, since malaria has been in these tropics for a long time, our ancestors used to know how to deal with it. There used to be herbs. So for us in our country, there is talk of herbs. These herbs used to make people immune to malaria. Okay, like I just when you give a 5-year-old this herb and they take it like up to their teenage years, even if like they're exposed to mosquitoes, they're not just going to get sick. But now we are seeing that this all the vegetation has been cut. We are now raising like people with weak immune systems, and so all that's the section of health. There's also how they used to deal with agriculture. There's also how they used to deal with this extreme event. So it's also a very important research area, one that once you convince your donors can get a lot of research funds. So climate change is a very, very, very big, like you can, for example, in that community of Sarah, I'm very sure there's some loss and damage due to floods. So you can research that loss and damage and document it. And after documenting it, you can even document that these are the interventions I've planned and even get some funding for it. And you hope because there is a loss and damage fund. There's a loss and damage fund available to countries in the global south. So you can convince some people, you can write a very compelling concept note regarding that is like a community. So for climate change and health, it's really, even if you're a teacher, even if you're a doctor, even if you're a researcher, even if you are like from most likely from anywhere, you can come and yes and be part of the effort.
Yes, before we end the session for today, because it's already like almost time, we can take one or two more opinions and ideas from the audience. Does anybody has got anything to add? Astaga, are you trying to share anything? I don't think so. Uh, would anyone like to add anything about how they are facing the issues of climate change and how they think that we can, as global scholars, help to solve the issue? Or like if you'd like to ask anything to the community?
Can I come in, please?
Yes, of course.
Okay. Hi, everyone. My name is Joyce. I think for me, it's more of a reflection. When we look at the issues of climate change, I think there's been a tendency to focus more on the insecurities that involve, issues like hunger, starvation. And so our focus is more like, even in the case of a disaster, you know, how many people are, homeless, how many people don't have food and all that. But I feel like maybe as scholars, I'm more interested in, not that these issues are not, they're very important, but I think there's one issue that maybe we also need to just put more focus on, and that is the nexus between climate change and mental health. Because alongside the displacements that are happening, the hunger and everything else that comes along, when people are repeatedly displaced, repeatedly subjected to different
Mm,
disasters or different climate extremes, or, I think the mental health aspect is kind of lagging behind in terms of how it is affecting
mm.
people of different, in different contexts, different genders and different ages. So I think maybe as scholars, we need to probably put a bit of attention again towards that direction so that it moves along with the other thematic areas that we predominantly focus on. So that was just a reflection. And I hope we will be able to have maybe a more nuanced discussion on, climate change and mental health as one of our sessions, should we have any experts or time permitting. Thank you.
Yeah, thank you so much for that suggestion. We would definitely keep that in mind when we design our other sessions. Joey, do you have anything to add?
Yes, what she's saying is true. There is data missing for climate change and mental health, even in the most developed countries like America and even in Europe. So if you start something within your community, it will very likely get some like traction, and really there's a gap, there is a research gap, like you said. Maybe what I before I forget, there's something as homework. There's something we call the Lancet Countdown of 2024 on Climate and Health. It's a report. It's available online on Google. You can pass through it if you're interested. If you're really interested in really enlightening yourself on climate and health, it's a very beautiful and big report. They've even put indicators. They did like a 10-year sort of like research survey. It's very interesting and very good. So if you are really interested in moving into climate change and health, you can like go and read up on it, the last report. Otherwise, thank you very much for setting time apart to listen to this topic. Please start something in your community, help your communities. Also, it's a collective effort from wherever we are. It's very interesting. It's a very interesting topic, climate change and health, or even climate change and everything, like climate change and indigenous knowledge. It's really a good thing to start now. It's getting out of attention and traction. Thank you.
Um, okay, wait a minute. I am trying to get the report. I think here it is. You can check this report out that Joy has just mentioned. And yeah, I think we should end the session now. It was a very reflective session for all of us. Thank you so much, everyone, for joining in. We'll take a picture before we close the session. So if you are comfortable, please turn on your video. And thank you so much, Dr. Joy, for agreeing to do this with us. It was reflecting session for all of us. And thank you so much, everybody who stepped in to share their experiences and their insights on the topic. This is not a one-time conversation. We will be continuing the conversation as the issue is taking over all the places in the earth. We will also continue the conversation and bringing this into light. While you turn on your video, I have put something in the chat box, which I will do again. Uh, so it is the links of the socials that we are actively posting on, so that you can stay connected with us. There's LinkedIn, where we post opportunities, our own events, and various news, articles, and other opportunities around academia. So stay connected. We also do that on Facebook. Our YouTube is the hub of resources where we post our previous programs, tea times, webinars, question and answer sessions, among others. Stay connected there also. Don't forget to subscribe us. And if you'd like to learn something that has already been covered in the past, please do stay connected in the YouTube. Our website link is also shared there. So if you sign up in our website, you will receive weekly or like bi-weekly email where we will be sharing these all resources with you. I think those would be very effective way to stay connected. So there is also a space at Rising Scholars, where our community member can share their opinions, insights, and experiences. Maybe one of you can write about what you learned in this session today and how you reflected by adding your own insights and work experiences, right? So, or any other topics, maybe share the findings of your own research or your experiences as an early career researcher. So you have the submission guideline there, and we will support you throughout the way. So for upcoming event on the 4th July, we have the question and answer session where we won't be covering any lecture, but just the question and answer on inferential and descriptive statistics. It is going to be covered by our steward, Stuart Felix, and I know that you are going to enjoy it because a lot of questions around data today will be covered there also. So feel free to sign into it, and I will see you then. So sharing the link and title in the email is not going to be possible because we send the email automated with the Zoom. So I'm sharing everything on the chat box. So if you could copy and paste it somewhere, it would be super helpful. Yeah. So I think this is all of us trying to take a picture here. Okay, so if anyone else would like to join in for a picture, please turn on your cameras. Yes, yes. Many people are joining in. I have never gotten all of the people to turn on the camera. Maybe this will be the first time. And we also run like massive open online courses throughout the year on various topics. Like right now, we are doing something on English research for policy and community. And then we are also doing on grant proposal writing. There are, yeah, and you can always check us out and you can always email me if you get confused about anything. Okay, so taking picture now. Hi everyone, please smile. Okay. One more picture. Do something fun maybe. Yeah, that's good. I can't do it, but then yes. Something more, one more picture. We usually end here, but then yes, that's the energy I'm talking about. Yes. Thank you so much, everybody. Thank you so much, Joy, for joining in and hosting the session for us today. We'd love to have you in our upcoming events also. And if any one of you would like to host such events with us, contact me and I will facilitate you throughout the process so that we can arrange something like this here.
Thank you.
Yeah, thank you so much. See you soon. Bye bye.